Model trimming. Once the impression trays have been removed from the models, they are ready to be trimmed. Glasses and face shield must be worn during this procedure. In addition, a lab jacket or other protective outerwear is needed. Face shields are kept at the model trimmer locations, and protective eyeglasses are the responsibility of each student. On a cautionary note, to prevent entanglement in the trimmer wheel, do not wear gloves during this procedure. Before starting the trimming process, soak the base only of the models in water for approximately 5 minutes. This will help make trimming easier. While the bases of the models are soaking, make sure you have all necessary equipment to complete the procedure. In addition to the model trimmers, you will need protective covering for the lab bench, a small ruler, a probe, compass, level, permanent marker, pencil, lab knife, Dremel with burr, sandpaper, and a few old scaling instruments. Using a lab knife, remove any excess gypsum from the back of the models that may prevent them from occluding properly. Because we're using base formers, there should be no need for a lot of trimming on the base of the models. Mark and trim the back side of the mandibular model. Draw a horizontal line about 1/4 inch distal to the retromolar pad. Go to the trimmer. Turn on the water and power sources for the model trimmers, one under the sink and one at each model trimmer. Be sure to put on your protective shield. Place the mandibular model on the table plate with the back side facing the trimmer wheel. Using gentle pressure, push the model into the trimmer wheel and remove gypsum up to the horizontal line. Rinse the table plate and the trimmer wheel with water before turning off the water and power. Use a wire brush to remove gypsum from the wheel. If this is not done, the gypsum will harden and clog the trimmer. Go to the lab table. Draw a line down the center of the facial surface of the mandibular first premolars on both sides of the model. Extend the line approximately 6 millimeters to the buccal fold. Draw a curved line from one first premolar to the opposite first premolar along the labial fold. Draw straight lines from the first premolar to the retromolar pad approximately 6 millimeters to the buccal fold on both sides. Make these lines parallel to the occlusal grooves. Trim the lateral borders on both sides, parallel to the occlusal grooves, up to the lines that were marked. These borders should be approximately 6 millimeters from the most lateral portion of the alveolar process. trim the anterior border in a semicircular line from premolar to premolar along the labial fold, approximately 6 millimeters from the alveolar process. The result should be a model with a distinct point at the premolar teeth. Don't forget to rinse the trimmer wheel with water and use the wire brush so as not to clog the wheel. When you've finished, go back to the lab table. Mark the center of the maxillary canines and draw lines which extend approximately 6 millimeters to the labial fold. Mark the midline division between the central incisors. Draw a line down this center division through the labial frenum, which extends approximately 6 millimeters to the buccal fold. Draw straight lines from the canines to the midline of the central incisors along the labial fold. Draw straight lines approximately 6 millimeters from the alveolar process from the canines to the tuberosity on both sides. Make these lines parallel to the occlusal grooves. Now go to the trimmer. Trim the lateral borders parallel to the occlusal grooves, approximately 6 millimeters from the most lateral portion of the alveolar process on both sides. These lateral borders should terminate at the midline of the canines. Once that is complete, trim the anterior border from the canine to the central incisor on both sides. Once again, you want to rinse the trimmer wheel with water and use a wire brush to prevent clogging of the trimmer wheel. Also notice that we have not trimmed the back of the maxillary model. Do not trim the back of the maxillary model. Invert the mandibular model with the teeth resting on a flat countertop. If necessary to level that model, use a compass to mark a parallel line to the occlusal plane. And if necessary, trim the base to that line. Now turn the model over on its base. The mandibular model should be level, and it should be between 1/2 to 3/4 of an inch in total height. Now occlude the maxillary and mandibular models and trim the back of the maxillary model to align with the back of the mandibular model. The backs of these models should be flush. With the maxillary and mandibular models occluded, trim the back of the maxillary model to align with the back of the mandibular model. Check the base height and level of the maxillary model. It should be approximately the same as the mandibular model. And if necessary, you can use a compass and a level to mark the maxillary base and trim until it is level and at the correct height. Once the trimming is complete, the occluded models are approximately 2 to 3 inches in height. At this point, you need to get instructor approval before proceeding to making heel cuts. Once that's done, with the models occluded, draw straight lines using a ruler from the maxillary canine points to the posterior lateral points from both directions. Once that is done, measure and draw lines approximately 1/2 to 3/4 of an inch wide, parallel to the opposing canine point. Now we go back to the trimmer to cut the heel portion of the model. While making your heel cuts, check often to make sure that you're not impinging on any of the teeth or other anatomical structures. The finished cast should be approximately the same height, with the art portions being 1/3 of the total height and the anatomy portion 2/3 of the total height. The overall height should be 2 to 3 inches. At this point, you're ready to finish and polish your study models. Use a lab knife and/or a Dremel with a burr to remove any excess gypsum from the art and anatomic portions of the models. Continue to refine the surfaces using sandpaper. Be very careful not to remove any of the actual anatomic surfaces. Now place the finished models in a model soap solution for 15 minutes. Remove the models and polish with a soft cloth or stocking material. And now write the patient's name, your name, and the date on the models with a fine line permanent marker. Occlude the models with the waxed bite and present to your instructor.